Hi everyone. Today we are treating this patient for hyperhidrosis in her underarm area. So starting out, we are just marking up our treatment zone. Typically, I like to do 4 rows of 10 dots, but you'll see here in a second that I go back and get rid of a few, and I just adjust my treatment zone based off of the specific patient and what area I'm really looking on focusing my treatment. So you'll see here in a second that I adjust a little bit, but I do like to have exactly 40 injection points. It just helps a little bit as I'm going in with my syringes, just keeping track of how much I am putting in each spot. But now that we have our zone marked off, we are just going to go ahead and get started. Like I said, we are using a 4-to-1 dilution, so it is more hyperdilute than what we would be using for a neurotoxin in the face. And these injections are very superficial. So I'm barely putting just the tip of my needle, almost just the bevel, to create this superficial bleb. That one was a good example, that top one of that row, how you can really just see it's just under that epidermis. And you have to be very careful because as you can see, I just dripped a little bit of product. Because we are just going so superficial. So you want to make sure you're deep enough that you're not losing product. But we are just repeating the same thing all the way down our rows. This patient was cleaned very, very well beforehand. That's something that I really like to stress. You want to make sure that there's no deodorant left on the patient. I also used a chlorhexidine prep and then I alcoholed right before we went in with our injection point marking. This obviously is an area that is not very clean, so we want to make sure that the area is as clean as possible prior to doing our injections. The patient was also numbed topically, which is a topical anesthetic, just because it's not necessarily a really uncomfortable treatment, but it is quite a few pokes. So just to make it as comfortable as possible for the patient, I do go ahead and use some topical numbing. But we are just repeating that same process all the way down our rows. I'm using a ComfortTox 0.5 cc syringe, so the needle is 31 gauge and it's only 8 millimeters. This is the same syringe that I'd really be using anywhere else for any other neurotoxin treatment, but it works fantastic for these small superficial injections because the needle is so small. But I'm just going ahead and just repeating the same process all the way down my injection points, really stretching that skin taut. It's going to help your needle just slide right to where it needs to be. And this is a pretty quick treatment. Before the patient leaves the office, I do provide them thorough education just as far as keeping the area as clean as possible. I tell them not to apply any deodorant, lotions, anything like that until the following day. So after treatment, just to leave the area be and keep it as clean as possible. Obviously, this does not completely get rid of sweating. This helps hyperhidrosis, so excess sweating. So whether that be just all the time or maybe when the patient's nervous, whatever the reason is why they are deciding to get this treatment, but it's not going to completely stop sweating. Obviously, we can't do that. That is not natural. That is the way that our body regulates itself. So this is just going to help with that hyperhidrosis, the excess sweat. It doesn't completely get rid of the need for a deodorant either. It can decrease the need and decrease odor just because we are reducing the amount of sweat. But I do tell my patients and just give them reasonable expectations that this is not going to completely rid the need for deodorant or completely get rid of sweating in this area, but it can be very helpful for those who struggle with the excess moisture in this area. I'm just going to go ahead and just give it a quick wipe with an alcohol swab and just keep the area clean, like I said, for the next 24 hours.